A project like Perigenomed, which aims to screen for hundreds of genetic diseases at birth in all newborns, is a project with national ambition. But in an international race for innovation, for access to technology for everyone, for scaling up locally, for integrating into routine healthcare systems, what does that really mean? I asked Julie Pouilly, who is the head of Kyowa Kirin internationally and who supported this first phase of the project, what this kind of initiative means on a global level.
The real challenge that we face is that we are actually developing life-changing therapies in rare disease, different modalities, new generation medicine. But here is the reality, in fact. If patients don't land with the correct diagnostics, none of the therapeutic innovation reach the patient. No diagnosis means no access means no life-changing value. Diagnosis is the real bottleneck and everything really starts here. Kyowa Kirin is a global Japan-based company and we operate in Europe, in the US and in Asia Pacific. We think long-term, we think global, and as we see everywhere, we face the same problem. Amazing innovations don't reach patients because they are not diagnosed. I was talking to a recent patient. They had to see 25 healthcare professionals to land on the correct diagnostics. It took years. It took a lot of money from the healthcare system, and it was quite inefficient and frankly impacting directly the quality of life of these patients. So we have to do better than that. As a pharmaceutical company, obviously we bring innovative treatments, but I think we have to think and act beyond that and addressing the root cause, which is having the proper diagnosis so the proper patient care can be provided. That's why we support initiatives in France like Perigenomed that explores genomic newborn screening to diagnose earlier and better, basically from when the babies are born. We are not interested in just isolated projects. It's part of a broader ambition that we have. It's to help shape a future ecosystem that will be much more effective, bringing together the medical community, but also academic, institutional, governments, so that innovation can actually reach patients. There is a lot more we need to do to provide this holistic view, and that's really what we are committed to. Kyowa Kirin, at our scale, we can absolutely not do it alone, and that's what it's really encouraging to see many pharmaceutical companies committed in rare disease wanting to come to the table and contribute to shaping and structure a better ecosystem. So that's the mission we are on.
What strikes me is this. Perigenomed is a French project, but the question it raises is European, even global. How do we build the systems, the coalition, the shared commitment that actually move innovation from the lab to the patient? That's the conversation I want to keep having.